We're going to look at the basic concept map for health education. The purpose of this concept map is to align all the work that you do within health education. So anytime you're asked to perform a particular task, you can refer back to this map to determine what you are doing, what goals you are trying to achieve, and what tools you can use to achieve that goal. We start anything in health education by identifying and describing a disadvantage. This is where we recognise an inequality in health between populations. Once we have identified that particular disadvantage, we seek to understand the influences that contribute to it. This is how we truly understand the disadvantage and how we can potentially address it. So we're understanding the influences that contribute to the disadvantage. Why does that disadvantage exist in the first place? Now, to move from our first goal to a second goal, we'll use some tools to help us understand the influences. Some of those tools include the social justice framework, the iceberg model, and the determinants of health. So by using these tools, we can move from identifying and describing a disadvantage through to understanding the influences that contribute to the disadvantage. Once we understand those influences, we have a good idea behind why the disadvantages exist. We then move to our third goal, which is the planning, the implementing, and the management of a campaign to address those disadvantages. To plan, implement, and manage a campaign to address the disadvantage. Moving from understanding the influences to planning and implementing the campaign are some tools generally called the models of health. There are a range of health models that you will be exposed to. The health belief model, the theory of reasoned action, theory of planned behaviour, all sorts of things, Ottawa Charter for Health Promotion. But all those models help us align our actions to the disadvantages so that we are addressing them effectively. And because the concept map is continuous, once we've planned, implemented and managed, we then evaluate our campaign, which allows us to identify further disadvantages within that campaign. The structure that we will use is the RE-AIM method: reach, effectiveness, adoption, implementation, and maintenance. So again, our numbers, number 1, number 2, and number 3 are the goals. These are the tasks that we're trying to do within health education. To move from one goal to another along the arrow, we use the tools that are specified. So in this example, the iceberg model will help us understand the influences that contribute to disadvantage. The health models will help us to plan, implement and manage a campaign to address the disadvantage. This is the basic concept map of health education.